Good afternoon, everyone. I'm Myra Ansari here for Wave Now. So we are joining Norton Children's Hospital today. If the flu or the other illnesses that are floating around have hit your home, I am so sorry. I know that things are probably miserable for you. My family went through it during the Christmas break. The flu hit my kids. It was terrible. So Norton Children's is reporting that 1,500 flu cases in kids in our area, and that marks the highest number of weekly confirmed cases this flu season. Currently, they have 7 patients that are hospitalized at Norton Children's because of the flu. So Dr. Heather Felton is going to be talking about this today. We are going to be joining her as she answers some things on how to protect your family, how to protect your kids, and ways to stay safe. Also talking about statistics that we're seeing so far right now. So just waiting for this press conference to get started, and let's cue it up.
We are seeing a lot of flu, especially among pediatric population. Through the first 3 days of this week, we are confirming about 500 positive flu tests a day. We are well on pace to have the highest week, not only for this flu season, but also for the past several years. And this is not necessarily atypical for this time of year, but so we were off school for 3 weeks. Everybody's back, and the viruses seem to be following suit. So I figure it's a good time to talk about really what we're seeing and prevention. We are seeing some hospitalizations. Fortunately, not many on the pediatric side, but we do have 7 right now. So it is important for parents to have the information to make sure that they know what to look for, keeping their kids home, and when they need to seek medical treatment. So, Dr. Felton, we'll go ahead and get started. I'll tee it up for you from there, and then we'll open it up for questions. So, from your pediatric office in Germantown, what are you seeing right now?
We're seeing exactly what the numbers are showing. We've had lots of kids who come in
Recording
with
in progress.
common flu symptoms, which is cough, congestion, fever, muscle aches, fatigue. And then we do a flu test, and they're coming back positive for flu A, which is the more common flu type to see this time of year. A lot of these patients haven't received the flu vaccine yet. Anecdotally, it seems like the flu vaccine does a good job of protecting kids this year. And so I encourage people to get their flu vaccine if they haven't already, even if they've already had a flu infection. But we are seeing lots of patients test positive for flu right now.
And do you feel that this has to do with, we said sometimes this happens, when we're into January, into February, but the fact that schools were out for 2 weeks and then that additional week, do you think that's having an impact on the numbers right now?
I think that that's likely because we see people who did lots of travel. They went to see family or friends over the holidays, and then they get back together. And when kids are then all together back in school, and then they start sharing germs again, and then we'll see these little outbreaks in schools or on a sports team. And it's really common to see that after kids get back together after being apart for a break.
All right, I'll have this question, then I'll open it up. Is it too late in the season to get the flu shot?
It is not too late to get your flu shot, and I would highly recommend doing that if you haven't already. Not only will it protect you from the flu A that's going around right now, but we haven't, at least I have not seen a lot of flu B yet. So as we progress through flu season, it will probably start seeing less flu A and more flu B, and I haven't seen any yet. And so I think that we still have plenty of flu season left. I'll probably see flu cases into March and April. So if you haven't gotten your flu vaccine, then I would recommend getting it.
Okay, open up for questions, and Paul, we'll start with you.
Dr. Felton, Joe had said there's 7 children who are hospitalized. How serious can this flu virus be for children?
I mean, the flu virus will cause death in children in the United States, and it does that every year. We have children who get admitted to the ICU every year with flu. Of all of the vaccine preventable illnesses that you could be exposed to, you're most likely to be exposed to influenza. And so it's one of the reasons why I highly recommend getting the vaccine and practicing things like staying home when you're sick, teaching kids too that they've got to cover their nose and mouth when they sneeze or cough. Washing their hands really frequently are all very important, but it can cause really serious complications for children. And even if they're not in the hospital, I've seen kids who've developed pneumonia after getting flu, or kind of develop reactive airway disease where it looks like they've got asthma for a couple of weeks, even if they didn't have that diagnosis before. And so flu can be serious for kids. It's not just a cold.
And what are the home remedies, if any, for children who have the flu?
I actually like a lot of home remedies. So Tylenol or ibuprofen work well for fever or pain. I usually recommend putting a humidifier in their room that can help with congestion and cough. And honey is actually my favorite cough syrup. No honey for kids under 1. They can't digest it well yet. But for kids older than 1, honey is great to help with their cough.
I was just going to ask, what are the symptoms parents should look for that show it's time to seek hospital care or more extensive care?
I think fever that's lasting longer than 5 days, if they get to a point where they're having difficulty breathing, extreme fatigue, if they aren't able to stay hydrated, signs of dehydration might look like not making as many wet diapers throughout the day, looking like the inside of their mouth is starting to look dry, or you can check their capillary refill where you kind of press down on their fingernail. And if it takes longer than 3 to 4 seconds for it to go from like a whitish color back to pink, then these are signs of dehydration. They at least need to be evaluated by their pediatrician.
Dr. Felton, when should school districts kind of evaluate, whether they need to adjust learning when so many cases of flu are going on?
I think it's up to individual schools. At our public school, we postponed some sporting events because so many kids on the team were out. So it's when there are an outbreak of so many students or staff where it's better to pause school for a little bit or go to a non-traditional instruction for a few days in order to help kids recover and not make people feel like they need to go to school to prevent absences in order to keep everybody healthy.
JCPS says they're seeing this peak a little bit later than they typically do. Do you think that's what you're seeing on your end as well?
I think it's usually around this time of year. It's usually January or February where it seems to be the worst. And so the fact that we had this right after Christmas break, and then there was kind of like another little mini break with all the snow days and the weather, I think that this is what I would expect to see for this time of year.
And when it comes to vaccinations, I'm seeing in Kentucky, especially Jefferson County as well, 13% in Jefferson County for flu vaccines, and children a lot less than adults. Is that typically the case, or is this different this year?
We have seen declining rates of flu vaccine in the last couple of years. And I think that's really unfortunate because, again, of all the things that you could be exposed to, flu is highly likely. And so I recommend for anybody who can get a flu vaccine, meaning you don't have an allergy to a component of the vaccine, that it's really important to get it, and it will help to keep kids safe. Even if they end up getting flu, it's usually a milder case than what it would have been if they weren't vaccinated.
Dr. Felton, if someone has the flu, if they get it, does your body have immunity for a while of getting it again, or can you get hit with a different strain, or how does that work?
You would have immunity to the strain that you were infected with for at least a little while, but you're right, there are several different strains that circulate at once. And so just because you had the flu doesn't mean that you're protected from all of the other strains that are out there.
And what's the window? I'm sorry. What's the window for that prescription medication? I know my kids took it when they had the flu to get that to cut down on the severity of it.
Yes, there are antivirals for influenza, but you have to start those within the first 48 hours of symptom onset.
You mentioned kids are hospitalized. Have there been any deaths associated with flu so far this year in children?
I have not heard of any here in Louisville.
And then a follow-up to that, do you think the lack or the decline in vaccination is why we're seeing this spike, one of the highest spikes in a few years, or what could be leading to just seeing more cases? Could it be the strain of the flu that we're seeing this year? What can lend itself to that?
So I do think that you can get variability in the strains from year to year. You could have one that is more contagious, for example, one year than another. But I really do think that it is declining rates of vaccination, because not only does it prevent those individual cases, but it also helps to prevent the spread of the virus among the population when more people are vaccinated. So if you see lower rates of vaccination, then you're going to have more cases in the community.
Dr. Felton, is the spike in cases putting a strain on pediatric offices and clinics?
We are very busy at the office, and I think our immediate care centers and our emergency rooms have all been really busy over the last couple of weeks. So you do see it this time of year every year, but I think that we've seen that a lot in the last couple of weeks.
Any other questions?
Just as far as it comes to vaccination, do you think that decline leads to just people misinformation, or why are we seeing a decline in those vaccinations as well for the flu?
I think that we've seen a decline in vaccinations since the pandemic, with people having concerns about lots of different vaccines. But what I would do is really encourage you to talk to your pediatrician, somebody who maybe you've seen for years prior to COVID, somebody who you know and trust, to answer any questions that you may have. I get the flu vaccine every year. I give it to my children every year. And every pediatrician who I know gives the flu vaccine to their children too. And so I think it comes highly recommended. And if there's a specific concern that you have about it, it's a great time to talk to your pediatrician about it.
When would this end, Dr. Felton?
We will probably see the spike over like the next couple of weeks. And then, but flu season can last until April. I'll probably still see cases into the spring.
Anybody else? Okay. Thanks for taking the time. I will send out a recording along with it. I've actually got a link to something that parents can use of, all right, when should I go to the hospital? When should I send my kid to the doctor? When is it okay just to keep them at home? We found that tool to be very useful. So I'll send it to you all. And if you can include it in any web stories, it would be tremendously helpful. So if you have any questions, feel free to reach back out.
All right, folks, thanks so much for staying with me on this stream. Norton Children's talking to us about the increase in flu cases in our area, ways that you can protect your family. They said just because if you've had the flu, a certain strain doesn't mean that you cannot be exposed to a different strain. So something to keep in mind, that if you haven't been vaccinated, they suggest that it's a good idea to still go ahead and get that vaccination for yourself and for your kiddos. All right, thanks so much for staying with me. Alina Noakes is following this story for us. She's going to have much more later today on Wave News. I'm Myra Ansari. Hope you have a great day and stay healthy.